Eye disease definitely become more prevalent as we get older. Things like glaucoma, cataracts, macular degeneration tend to increase in prevalence as people get older. And an eye exam at a younger age at least allows us to establish a baseline and make patients aware of steps that they might need to take to help limit their risk of vision loss in later years. A disease like glaucoma is a progressive damage to the optic nerve. This nerve does not regenerate. So any damage that's done by glaucoma before we see the patient, we can't reverse. We can only prevent or limit further damage. So early diagnosis is key. So ounce for ounce, the retina is the most metabolically active tissue in the entire body. So therefore anything that would limit blood flow is going to affect the eye first. The eye is almost like the canary in the coal mine for a lot of these diseases. So generally what I tell patients is what's good for your general health is good for your eye. It's also important to talk to the surgeon about what your expectations are for after surgery and what your visual needs are and what you're expecting your visual needs will be in the future. We can customize the procedure to the patient's own eye intraoperatively. We actually have something called intraoperative aberrometry that allows us that after we remove the cataract from the eye, we can actually scan the eye right there on the operating table, and this scan will tell us exactly which lens implant to implant and where to position the implant to reduce the residual astigmatism as much as possible and reduce the patient's dependence on glasses for astigmatism.